My name is Dr. Susan Russell, and I work at Sydney Children's Hospital at Randwick, and I am employed as a paediatric haematologist oncologist in the hospital, and I also work for the University of New South Wales teaching undergraduate medical students.
Today, we'll be interviewing Dr. Sue Russell, the Senior Staff Specialist and Head of Clinical Haematology at Sydney Children's Hospital, Randwick. Dr. Russell is also a clinical supervisor and lecturer to medical students at UNSW. Not only will we be interviewing Dr. Russell today, but we'll also be hearing from one of her patients, Birney.
So, Dr. Russell, what does your job consist of on a daily basis?
The majority of my day is spent in the frontline day-to-day care of children who have cancer and non-malignant blood disorders. So I will do a ward round in the morning and talk to the families and the children who are inpatients, examine most of the children. We look at the relevant blood tests and x-rays that have been performed and make any day-to-day decisions about their clinical management. Another part of what I do is conduct outpatient clinics where the patients are at home but they just come in for the day to have treatment.
So Birney, how did Dr. Russell make you feel like you were in good hands?
Well, Andre, her professionalism was really evident in the way she spoke, how confident she was, how she explained everything to the extent that I understood every single aspect of it and was confident in going through with it under her guidance. So, yeah.
So when she spoke, you could feel basically the years of education and experience that she's had in the medical profession, especially as a specialist to deal with cancer.
Oh, absolutely. You know, like, at that time, I was only in year 7, so I was quite young, but I could still understand how she was, adapting to my circumstance. Okay. Undoubtedly, you have to be in a lot of high-pressure situations. How have you learned to deal with these situations?
Very early on in my paediatric career, when I was a very busy paediatric resident, this is before I specialised, the unit I was working in was enormously busy, and I learnt and trained myself to not panic and just be methodical and focus on the task and the patient and the case that I had in front of me at the time, and to work my way through that, complete that, and then move on to the next. And if I kept my head and didn't panic and didn't think, oh my God, I've got too much to do, how am I going to cope? If I kept those thoughts out of my head and just stayed focused, I managed to get through it.
I'll pass it on to Andre then for the next set of questions.
What inspired you to become a medical, and get into the medical profession?
I was one of the first people of my generation in my family to go to university. I think it was more, as best you can think about these things when you're 18, I think I had a general desire to help people and be a useful member of society, and that combined with science subjects that I did in the equivalent of year 12 and biology, especially, that I liked. I thought, well, the two things that combine those two things together, the thing that combines those two things together is to do medicine. So I applied and was fortunate enough to get in.
Beautiful. And with that being said, when you applied to medicine, obviously the system is very different. How do you think it's changed? Has it become harder, or has it become easier to get into medicine?
Look, to be honest, I think it's probably harder. I wonder if I had to apply today whether I would actually make it. In my day, and this is 35, 36 years ago, the only way to get in was to do well in your year 12 exams, and that was the only thing that mattered.
What was the path like from year 12 to now in terms of medical school, specialisation? What was that like?
It was interesting. I started out, I did a couple of years of adult medical training, or training in adult medicine, and then I took a year off, and then for various reasons, accidentally landed in a paediatrics job and decided that I really liked it. I really felt at home and thought, no, this is the path for me. And then I was fortunate enough as part of that training to do a term in paediatric haematology oncology, and that really sealed it for me. That was perfect.
What was your university life like in terms of not only the course structure, was it difficult to balance, but also the social aspect with other medical science, medical students in your case?
Well, I was a medical student in the 70s. And, it was good fun, shall we say.
Okay. Do you remember what your first year of postgrad medicine was like? Besides all the fun in the 70s.
Yes, I probably didn't work as hard as I could have. I certainly didn't work as hard as I had in year 12. There was all that biochemistry and organic chemistry, which was pretty awful. But it was basically, I think it's once again different to what it is today. In the first 3 years we did physiology, chemistry and anatomy, very heavily focused on that. And then the last 3 years were clinical, whereas now it's a lot more condensed.
And you said before that you didn't really achieve the best results in first year medicine. Do you think that was just partially...
I picked up in later years.
Yeah. Do you think that was because of the pressure, or do you think that was just because of year 12 and
Yes, I think it was just because of year 12. You know, you're still young, 18. University is a completely different scene to the relative rigidity of school. But yeah, you have to keep your eye on the ball.
We touched upon the importance of networking.
Mm-hmm.
Do you agree that networking is pivotal to success, particularly in the medical profession?
Yes, I think that probably is true to some extent. If you're a shy person, it can be quite difficult, but it's worth it. It paves the way for collaboration with your colleagues in terms of research, improving your teaching skills, improving your communication skills, broadens your horizons in so many ways.
What's one of the most important skills you think you've acquired throughout your life, your medical life?
The best skill that I have acquired is the ability to communicate clearly. And that's both with my colleagues and also in explaining complex situations to patients.
Obviously, technology has changed since you've begun to now.
Yes.
How do you think that's influenced how you diagnose, treat, or interact with patients?
Right, enormously. When I was a medical student in biochemistry, we studied DNA and RNA and protein expression and ribosomes, and that was a hot new topic, and that was at tertiary level. And now my children studied that in high school. And now the whole genome has been sequenced, whereas we were back to, the base pairs in my medical school days. So the explosion in knowledge in molecular biology is just astronomical, and it has completely changed the landscape in terms of diagnosis, and it is now currently changing the landscape in terms of how we think about treatments for patients. It's very exciting.
Well, this is a bit of a sidetrack from the other questions, but in a movie about your life, what would you call it, and who would play you?
Oh, goodness. Unlike all the other questions that you've asked me, where I feel that I've been able to give a reasonable answer off the cuff, this is not one of those questions.
Okay.
And I honestly don't know. I can't think of a title. I'm even struggling with a genre. And as for somebody to play me, absolutely no idea.
What have you gained from your experience working in this very prestigious Sydney Children's Hospital?
Oh, I've been very fortunate. It's given me the opportunity to pursue the career that I like. It's given me the opportunity to do research. It's given me the opportunity to teach medical students and other students, and as well as postgraduate students and young doctors. So I consider I've been very fortunate to be able to work here.
Beautiful. Well, that's the end of the interview. Thank you for tuning in. I'd like to thank you for obviously giving out some of your time to let us interview you, and yeah, thank you.
Pleasure.